The topic today that we decided to address was really thoughts related to the early treatment and early diagnosis, and actually the preclinical diagnosis of Parkinson's disease, a novel area that is starting to receive a great deal of attention as we begin to think about strategies not only to treat the disease, but actually to treat it in its preclinical stages and perhaps even one day prevent the onset of Parkinson's disease and other neurodegenerative diseases as well. So what I'd like to do in the next 45 minutes or so is take you through a tour of the modern approach to patients in the early stages of Parkinson's disease, some of our thoughts about treatment, some of our thoughts about modifying disease, and then finally how we might approach an individual who may be at risk for developing Parkinson's disease. Now, as you know, Parkinson's disease may not be one disease. It's a very variable and heterogeneous disorder that affects every patient differently. Patients with Parkinson's disease may have different signs and symptoms and certainly varying rates of disease progression. And this, in fact, may be one of the limitations of current clinical trials and methodology. When we do a trial of a new drug for Parkinson's disease, we actually include all comers with the diagnosis. I think one of the areas you may tend to see in the future is trials that are more geared towards patients with specific subtypes of disease. Now, you're all familiar with the Lewy body. The Lewy body is really the pathologic footprint of typical Parkinson's disease. And it's interesting that once we began to identify genetic forms of Parkinsonism, particularly starting with the alpha-synuclein mutation, even those, for the most part, have Lewy bodies at autopsy. Although there are other inherited forms of Parkinsonism, like the autosomal recessive Parkin mutation, that may not have Lewy bodies, although the clinical symptoms may be identical to those with Parkinson's disease. So we've begun to really think about the Lewy body somewhat differently. While it continues to represent a pathologic hallmark of Parkinson's disease, much of the basic science focus is on the what the Lewy body actually does. Is it a pathologic marker? Is it a protective marker? And these are areas that you'll hear more about in the future. Now, one of the issues as you all approach a patient with Parkinson's disease is that this remains a clinical diagnosis. There's no biomarker as yet for Parkinson's disease, although I believe that in our lifetime there will be a series of tests that we can do that really will be able to confirm the diagnosis, particularly early in disease. But right now there are mistakes that are made even by the best clinicians. The diagnostic accuracy rate for patients with early disease is probably about 85 or 90%. That means that 10 or 15% of patients that are diagnosed with early Parkinson's disease and actually enrolled in some of these clinical trials I alluded to may not, in fact, have Parkinson's disease. And this really obviously has a lot of implications as we look at interventions in early Parkinson's disease. You can imagine that if we include 10% of our patients who turn out to have diseases like multisystem atrophy or more rapidly progressive forms of Parkinsonism, that may very quickly nullify the positive impact, the subtle positive impact, that a particular kind of intervention might have. So diagnosis is very important, particularly for clinical research.